Hello everybody, Medicare Dana here. Today I'm going to talk a little bit about IRMAA. IRMAA stands for Income Related Monthly Adjusted Amount. Some people may never experience an extra IRMAA charge. Other people are very familiar with IRMAA. And then some people have never heard of it, even if they've talked with Medicare agents. It's something that unfortunately some agents overlook or don't talk thoroughly about. And I want to make sure anyone that is on my page that's looking for Medicare resources understands IRMAA, because it's incredibly important as you plan financially and as you think about your Medicare now and in the future. For your Part B premium, there is a monthly cost that is determined by the government. So every year there's going to be a standard monthly Part B cost. This is based on income. It's based on individual income or income if you and a partner file together with the IRS. It's based on your dual income. For high wage earners or people that have more income that goes outside the specific standard based on their IRS tax returns, you will get an increased charge on your Part B premium. There are brackets once you hit a certain level outside of that amount that the government offers for that standard, what the standard income is. There are brackets, there are 4 or 5 brackets that go up depending on what your IRS tax returns say. So if you are a high wage earner, or if you wanted to move funds, if you sold a house, a home, and that money is going to show up on your IRS tax return, you're going to get charged additionally because of it. So it's really important to understand the IRMAA charts. Every year they change, just like the standard Part B changes the premium, so does the IRMAA chart. So you want to make sure that you are looking at that your Medicare agent's talking you through that. Your wealth manager and financial planner should also be walking you through that. Now, the one thing to remember is that Medicare's premiums do a 2-year look back. So they're looking at your tax returns 2 years prior to your start date. So if you're starting in the year of 2020, 2022, 2024, they're going to look at your 2020, or starting in 2020, your 2018 income. They do a 2-year look back at your IRS tax returns, and that's what they're basing your Part B premium on. Now, something to consider. There are options where you might have had a higher income 2 years prior, but the year that you're starting your Medicare, you've got a major decrease in your salary, maybe because you're retiring. There are certain things, there's 8 things that Medicare and Social Security consider to be life-changing events. It's called the life-changing event form that you can fill out, that if you've had one of those 8 things, Medicare will look at that and they will adjust your monthly amount to basically show what your income would be for that year. Again, because IRS does a 2-year look back, they can't see your income for that year. So you have to fill out a form, offer some evidence to show, like I retired or death of a spouse is one. But there are 8 different things that can happen that are considered life-changing events. So should you have an IRMAA charge, but you've had one of these life-changing events, you're able to file a form to ask them to adjust your monthly premiums to that current year, which might make more sense based on what's going on in your life. The reason why IRMAA is so important is because as you plan for your retirement, as you plan financially, you want to know what's going to be expected. No one likes surprise bills. But also when you turn 65, there's lots of rules around who has to enroll and who doesn't. Feel free to look through all my library videos to find this, because there are very specific rules. One of them being, if you work for a large company, 20 people or more, you can delay Medicare without penalty. Sometimes it makes most sense for people to maintain their employer plan. Other times it makes sense from a financial or from a medical perspective to switch into Medicare. But knowing about this IRMAA affects the cost. So because when you retire, lots of people have less of a salary, they're not going to get an IRMAA charge. But if they switch into Medicare while they're working, they might have a large IRMAA charge because they're high wage earners. You got to look at all of that as you determine what makes most sense for you financially and medically when you enroll in Medicare. We offer all of this review free to our clients. It's part of our consultation purposes. I highly recommend, if your agents aren't talking to you about IRMAA, if you've never heard of IRMAA, to do your due diligence. That's what these videos are here for, to help you make sure that you have all the information that you need so that anyone calling you can't tell you something that is inaccurate and then have it affect you poorly. My name is Dana Lastman, MedicareDana.com. I am here to give you as much education on Medicare, help protect our community, and make sure that as you retire, you have the funds and the information to do what you've worked so hard and enjoy that retirement. I look forward to answering any questions. Should you have any, contact me. My information is linked in here. Take care, all.